Hari Singh, this is a case of Hari Singh that we saw yesterday. So now they are going to kind of explain to the patient the diagnosis and other part. Please start.
So Mr. Hari Singh, you just finished your examination and I've gone through your investigation reports. So how do you feel now?
I don't know, ma'am. Is that any serious?
Seeing your after your examination, I just feel there is a hernia, right-sided hernia, and it occurs because of increase in your intra-abdominal pressure, and because of that, there is a weakness in your abdominal wall. So
try to use least technical jargon. So you are not talking to a doctor. You are talking to a lay person. So abdominal wall, all that they will not understand. Increase intra-abdominal pressure, that's something they will not understand. So your language has to be as though you are talking to the patient. Again.
So because of the weakness, your bowel contents, the intestines has come out, is protruding through a defect. So because of that, there is a swelling in that region. And since you're a smoker also, maybe because of increased cough, when smokers have bronchitis, and because of that, there can be increase in the pressure and that can cause herniation, and also you have complaints of increased frequency of micturition at night. And after your rectal examination, it looks like you have benign prostatic hypertrophy. Prostate is it is a gland which it surrounds the urethra, and because of enlargement of that gland, there is
what is gland? Gland. They don't understand the gland. No? How will you explain gland? So we have to see. This is what we have to learn. This is the purpose of doing it. Yeah.
Prostate is a structure which surrounds the urethra, and sometimes it can, due to its enlargement, that is, it increases in its size, and it can cause obstruction to the outflow of urine. Because of that, urine is not completely passed, and it can cause retention, and because of that, you have increased frequency.
You are explaining to an intern. You are not explaining to a patient. Will the patient understand what you are saying? This is what I want you to learn. You have to talk as though you are talking to a lay person. If you get ready to talk to a lay person, then you can talk to anybody. So I have to explain him two things. One is about hernia, how it has happened, and then one about BHP. So I have to tell what it is and then what you are going to do. But most important is explaining in the lay person's language. Would you like to try again? Okay.
Can I talk in the local?
Yeah, you can. You can. Okay, even I don't understand, I'll have to understand the tone and the.
So ಇವಾಗ ಪ್ರಾಸ್ಟೇಟ್ ಅಂದ್ರೆ ಒಂದು ಗ್ಲ್ಯಾಂಡ್ ಇದೆ, ಅದೇನಾಗುತ್ತೆ ಅಂದ್ರೆ ಅದೇ ದೊಡ್ಡದಾಗಿದ್ಮೇಲೆ ಯೂರಿನ್ ಹೋಗುವಾಗ ನಿಮಗೆ ರೀಸಸ್ ಹೋಗುವಾಗ ತೊಂದರೆ ಆಗುತ್ತೆ.
Pay attention.
ಅದು ತೊಂದರೆ ಆಗುತ್ತೆ. ಅದು ಯೂರಿನ್ ಬರ್ಬೇಕಂದ್ರೆ ಅದು ಗ್ಲ್ಯಾಂಡ್ ಸುತ್ಕೊಂಡಿರುತ್ತೆ, ಈ ತರ ಸುತ್ಕೊಂಡಿದ್ರೆ ಅದು ಅಲ್ಲಿ ಅಡ್ಡ ಬರುತ್ತೆ, ಅದರಿಂದ ಯೂರಿನ್ ಫುಲ್ ಆಗಿ ಆಗುತ್ತೆ. ಅದರಿಂದ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ನೈಟ್ ನಿಮ್ಗೆ ಎದ್ದು ಮುಂದಕ್ಕೆ ಹೋಗ್ಬೇಕು ಅಂತ ಅನಿಸ್ತಾ ಇರುತ್ತೆ. ಅರ್ಥ ಆಯ್ತಾ?
Doctor, but you are telling two conditions. Is it very serious? We have to
because it's for right now he's having it for the past 6 months, and his bowel movements are also regular. That is, usually what happens is this intestines they get inside and they get obstructed, and because of that his bowel movements may worsen. But then right now his bowel movements are regular, but it can worsen anytime. It can go for complications. Right now it's not complicated. Yeah, it can happen anytime. So if in case you can undergo surgery for this, and because the hernia is not treatable by medications, and only treatment is surgery for this case. And surgery can cost you around 50,000 to 1 lakh. And because he has another condition also.
He will okay after that surgery.
He has another condition also that I was telling about prostate hypertrophy. So you have to treat both, because benign prostatic hypertrophy also can be surgery, or can we give medicine? That is so that treatment is surgery, but it can be controlled under medications, and I will refer you to a neurologist for further opinion, and you can go to them and talk. He will explain to you better. And
Doctor, this surgery is needed immediately or we can wait?
better to have it immediately, because right now it's not complicated, and you don't know when it can go for complication. Once it's complicated, it will be very difficult for the surgeon to operate, and for him also it can undergo strangulation and electronic
Actually, we
resuscitation.
have a family function also. After that, can we wait till that time?
1 month. He's a known, he's already had a coronary artery, he had an obstruction and he's undergone angioplasty for the same. And
Should we admit him or can we take him back and come back?
Because it is an important surgery. We want him to be there.
okay. So, okay, fine, you people can take him home. And but then if there is any emergency, if you think he's not doing well or he looks sick, we can admit him immediately. And once the function is over, please come back, and until then I'll give you medications, and you have to meticulously take the medications. And since you're on, you're taking medications for BP also, I think you should control that also, because before surgery, all your blood sugars and blood pressure should be controlled. Then only we can post you for surgery. And also you're a non-smoker, so you try to cut down smoking, because that can also that can worsen your condition. So you should stop smoking and control and stop smoking. Do you have any other doubts, and have you understood?
And what food should we give?
Any diet which is rich in fibers, because there should not be any intestinal obstruction. Any diet which is rich in fibers can, and it contains a lot of fluids also, stay hydrated. And since you are known, you have blood pressure, the salt restriction is better. Anything else?
After we come back for the surgery, how long is the surgery?
In the surgery, actually the procedure of the surgery is, because there is a defect in the wall, we will reduce the pathetic, we will replace the bowels push it back into the abdomen where it is supposed to be. It's usually outside, it's not where it is supposed to be. So we'll push it back inside, and then to strengthen the wall, we will keep a mesh. So the mesh will be staying in the body, and it will not cause any harm to your body.
No
So,
complications.
any surgery has its own complications, but because and is known, he's undergone surgery before also. So you have to be prepared for any complications, but I can assure you it will not be very serious, because it's just a mesh repair, and nowadays many people are being operated for it.
How many days we stay in the hospital?
Hospital stay before surgery 2 days, because you have to do the pre-anesthesia workup and all, and after that maybe a week or two, depending on his condition and how he's recovering from anesthesia and how he feels. Anything else? So now you'll come back after 1 month once the function is done. We'll attend. Are you happy?